IC. Our friend, the State Insurance Commissioner and State Fire Marshal Mike Chaney, and also it is Dr. Mark Horne on the phone. Perez, you can turn them on. And in the House, it's Senator Nicole Boyd. She is from District 9, Lafayette Panola Counties. Vice Chair, by the way, of Senate Universities and Colleges Committee. Senator, good to see you.
Good to see you. Thanks for having us all.
Everything okay in the Oxford area? Ready for baseball?
We are ready for baseball, delighted with the governor's orders, and we're ready to put some fans in the stands.
Ready to put some people back in the restaurants, too.
That's right.
So we got a lot of news, the timing of that, because national news on Fox was covering that just about every hour between Texas and Mississippi, making that decision. So Is Mike Chaney there? Good morning, sir. Are you there?
I am here, Paul. Good morning.
Good to have you. And also Dr. Mark Horne. Dr. Horne, President of State Medical Association. Are you there, sir?
I'm here as well, but I'm having some terrible feedback. I'm trying to call in again on a different line.
Why don't you do this? Why don't you go on and hang up, and Perez, if you'll take care of that and call on a different line, and we'll get you taken care of. So, first of all, let me go to Senator Nicole Boyd. Explain this bill, and again, exactly the need for it. It's SB 2631, and what's the problem, or what's the solution, and fill us in on this one.
And what's the opportunity on this one?
And what's the opportunity? That's the word I was looking for.
So, during the pandemic, this whole state. It was incredible, the ingenuity sometimes that we did in cartwheeling to do new things and new skills. And we've had telemedicine in the state for some time, but it wasn't completely embraced by some aspects. And so what we saw providers, we saw patients. When the insurance commissioner put the bulletin out that telemedicine should be used when possible. And we all saw people really use this and embrace this. And what we saw providers across the state. We've had 2 hearings. We had a hearing in the Senate, and we had kind of a meeting in the House Insurance Committee. And what we saw is providers giving testimony. We had physicians, we had nurse practitioners of all of the advantages and the extreme use that they used with telemedicine. Mm-hmm. This is something that is another tool in the toolbox for healthcare in the state, and we need to make sure it continues after this pandemic is over. And so we had a number of the insurance providers do a great job with this and make sure that when the providers were billing, that they could bill at the proper codes. And we had for the majority of those providers and all of that, we had some really great positive experience. We had one kind of provider that we had some issues with, and they weren't wanting to let providers bill at the proper codes. Now, you may not think that's a big deal, but for a provider, if they don't bill at the proper codes, it can be unethical and illegal completely to either upcode or downcode on codes. And so
was this one of the major providers?
It was one of the major providers in the state. Mm-hmm. And so and what they would do is they would only allow them to code at a certain level. And so that was basically like a 30-minute visit. And so we have psychiatrists who use this. We have primary care nurse practitioners and physicians who use this, and across the state. And so oftentimes what would happen is they just wouldn't be able to bill.
So they were capping the fee.
They were capping not just the fee, they were capping really the length of visit even that you should have. And so these codes are there for the you code on the complexity, the length. There's a whole standard that kind of the government sets as to how you do that.
So you wrote the law or this bill?
Senator Walter Michel, this is his bill. I had a different bill. We merged all of our bills together. Senator Michel has shown great leadership on this, having hearings.
Right.
And
real quick, what does the bill say?
So what the bill does, it says that a provider can bill at their proper code, at what they're supposed to do morally.
They must do, or is it voluntary?
No, they must bill at their proper code, because they have to do that, from the federal government and ethically as well.
So in other words, they would be, let me get to the insurance commissioner. Mike, this would basically mean that if what you're doing now is treating a telemedicine call as an in-house visit call or in-clinic visit call, and that's got to be continued, is that basically it?
Well, it allows the continuance of it, Paul. What you need to really look at is the issue that the impetus for telemedicine began on March the 14th when we issued our bulletin and Governor Reeves issued the state emergency executive order during the pandemic when it started. The feds issued a bulletin right after that allowing Medicaid to expand telemedicine and waiver the HIPAA requirements and et cetera. And the reason for this was to allow a doctor that had a relationship with a patient to use telemedicine or cell phone to consult with that patient without having the patient to come in and be exposed to COVID-1. And number two, it helped those over the elderly, those 50 or incapacitated, to have access to medical care without having to go into a clinic. Especially, it's valuable in the Delta where you have limited health care, so it provided and expanded some health care. And the issue with one provider became one of coding for psychiatric help or mental health parity, which is required by federal law. So our bulletin expanded the scope of practice, to use the scope of practice of telemedicine to provide health care. And all we're doing is trying to keep that in place after the governor's executive order goes away. And if we don't have a bill, then the federal government will probably make us adopt their bills. We can pass a bill stronger than theirs, but we can't pass anything less than the federal government. So this is also an attempt to keep the feds from coming back into our state.
Dr. Mark Horne, President of Mississippi State Medical Association. Dr. Horne, what does this mean to you as far as bottom line is concerned?
Well, the bottom line is we get to take care of our patients. We've known that telehealth had great promise in the state, particularly for our rural areas, and we've talked about that recently as well. But by having telehealth, a strong telehealth presence, as we currently have, and extending that, and it's going to go away, as the commissioner just stated, when the emergency orders go away, unless we have this bill, unless we have these protections, then telehealth will disappear in Mississippi effectively. And there'll be some elements of it, but it'll go back to the old days when my colleagues couldn't do telehealth effectively. This allows me to connect with my patient in their home from my office. I could not do that before this bill, before this emergency order and these pandemic conditions. This preserves that for the future. It makes a tremendous difference to the health and welfare of the patients throughout Mississippi, who can now access their physician from wherever they are.
Is there an average telemedicine visit time link on there that you've been able to pinpoint?
So, it depends on the specialty. People like psychiatrists can do essentially the same as an in-person visit by phone, and they can spend an hour or more, and they need to be able to charge for that. If they charge, and what our other guests have already said, your other guests have already said, if we say that it's worth X, but they only let us bill for Y, that's fraud, and we can't do that. We're ethically and legally bound to charge for what we did. That's not making that up. And this goes for all providers, whether it's a nurse practitioner, a PA, or a physician. So it's crucial that we allow. So is there an average? A lot of the things that we do by telehealth are simpler. I personally see a lot of complex patients, and I can spend 30, 35 minutes on the phone quite easily, the same length of time I would spend in person.
Mike, I got to ask you this, though, but I mean, that can't be... This has got to be the same conundrum to other states too. Everybody's got to be going through this, are they not? I mean, it's not. It can't be unusual for just our state to be facing this.
Other states face the same thing, Paul, but they haven't had the conundrum, for, as you may say, that's your word now, conundrum that we've had in Mississippi.
You can use the word.
Well, it's a good word. I like it, but we've got one provider in the state that just wants to kill telemedicine, and it's all over coding. They'd rather pay for 15 to 20 minutes instead of for an hour's visit in some cases, or can't really get a hand around why they want to kill the telemedicine bill. But
you want to mention who that is? We'd like to know who that is.
Well, it's our largest provider in the state. I've said it's Blue Cross Blue Shield. They're against it, and we have had no communication with them. We could work things out if they would just sit down at a table and communicate with us. we're not trying to regulate them to the point of telling them how to practice medicine. We're trying to provide a service to the citizens.
All right.
It's just that simple.
Let's go into it a little bit deeper when we come back. Quick is Senator Nicole Boyd, who gavels in, what time, at 10 o'clock this morning?
10 o'clock this morning.
House at 2 o'clock this afternoon, and the Senate is at 10 o'clock this morning. And on the phone, it's Mississippi Insurance Commissioner, State Fire Marshal Mike Chaney, and Dr. Mark Horne. A couple of things that we were talking about off air here. There are people who says, well, we love the telemedicines because doctors can make more, they can push more people through, which is absolutely the contrary if you think about it.
It is the contrary because I've talked to a number of providers and gone in their offices, and so usually they have multiple rooms operating at the same time.
Yeah.
They have, usually 4 to 8 patients that are in different rooms that they're going back and forth between. And so with a telemedicine visit, and in fact, that came out during the hearings of some of the senators because they felt like their family members got even better care on a telemedicine visit because that provider was solely focused on their parent, at that moment. And so they can't do as many visits when they're doing telemedicine because they're singularly focused on that. Additionally, one of the things that's come up with the providers is we're still not that technology savvy sometimes in Mississippi. So some of our patients, particularly our elderly patients, have a little difficulty getting on and off, and it takes a little bit more time from their staff and them to help them out.
They get up, walk away, and they can't do that. You've got to be in front of the screen. And Dr. Horne, the other part of this that people don't think about is the savings to the insurance company itself. I would think that's some of the research, is it not? And if that's the case, why in the world would Blue Cross Blue Shield be ready to come to the table?
We've talked to them. I don't know why they don't want to come to the table. It can improve quality because you can get more patients. We can see people more often if we can do these visits between office visits. It's easier for the patients. It's easier for us in some ways. The telemedicine is the future. It really is. The other thing is a friend of mine was just telling me, during the recent snow and ice storm, this physician was able to see 17 patients that day in their office. No one could get in. They were able to provide care when care wasn't available otherwise.
Well, it's also a savings, not only that, but a time for the patients themselves, because if you get an appointment at 2 o'clock, you're going to show up mostly at 1:45, if not 1:30, it depends. And sometimes you guys can't get to us at 2 o'clock. It may be 2:45. There's an hour sitting in there doing nothing, not being productive. So to the insurance commissioner, what's the next step on this one? This bill is Senate Bill 2631. Will that solve the problem, Mike?
It'll solve 99% of the problem, Paul. And if it does fail in the House and the Senate, we'll go back to the drawing board. We'll probably have to adopt the federal guidelines, which can be pretty tough for the state of Mississippi. It'd be basically the same thing we have for Medicaid. But the Senate's pretty sharp, and I think Senator Boyd may want to talk about what she has done to the House bill that came over from the House. They stripped the House language out and reinserted the Senate language. So that bill, if it passes the Senate and goes back to the House, they can either concur or go to conference, and hopefully they would concur and would be over with this mess for a while.
So yesterday we had the House bill came over, and the House bill had those open code sections in there. Representative Ford's bill, who's the vice chair of the House insurance over there. And so what we did is Representative Ford had addressed one aspect that needed to be addressed, but not some of the other aspects. And so with his bill, we expanded that, and we stripped that language out, and we put this whole bill, we put basically 2631 back into that House bill. And so that passed out of our Senate Insurance Committee. And so that bill will now go to the Senate floor as well. And so if the Senate if the body adopts that, then that will go back over to the House, and hopefully they'll vote to concur.
So you think the disagreement was solved in there? Was it a disagreement or just some type of course, just a recourse to make things right?
Well, it's just we just did a lot of we just went greater in depth, and so we Senate Bill 2631. as Commissioner Chaney has, and we've worked extensively with the Commissioner's office with this, and we've actually worked with a number of the insurance providers in the state. We've worked with the telemedicine, some of the telemedicine companies, and we've worked obviously with the healthcare providers. And so, and we've got really a very strong coalition of people that are supporting 2631.
Commissioner, if this does pass, can it wait till the fiscal year, or is it something that, as we hopefully get back to normal at a faster clip now, is it something that needs to go into immediately, or can it wait till the fiscal start of the fiscal year?
I think it needs to go into effect upon passage, Paul. If we wait until the 1st of July, you're going to have a void of several months. It appears the governor's going to remove some of his emergency orders. One of them starts today on the mask mandate and so forth. So it needs to be in place as quick as possible to have continuity in care. And you got to remember, this is a cost reduction for most of the companies. It's a better way to deliver health care at a time-saving format for the patients. So it's a win-win for everybody. We've just got one group that, for various reasons, I won't expound on why, are against the bill. If you could just get people to sit down at a table, Paul, which I've heard you say 100 times, and talk, we could work things out.
Well, as far as the addition of any new providers in the state of Mississippi, where are we with that?
Well, we got Molina this year to cover the ACA. And by the way, the ACA would adopt our rules if we promulgate them, and Senate Bill 2631 is adopted. But in light of the fact that we may not have a bill, they would adopt the federal regulations. But we have several new carriers. We've got two that came across my desk yesterday that the state health department, Dr. Dobbs, had approved for them to operate in the state, and we look forward to getting them on board, and that will probably happen within the next 90 days. Two more healthcare providers.
Dr. Horne, have you heard, what's the latest as far as Johnson & Johnson's concerned in the state of Mississippi?
We're excited about the possibility. There needs to be a conversation between the physician and the patient as to which vaccine is best for them. We're still trying to figure out exactly what that's going to be. My current take is that the J&J is likely to be something we're going to use more for the younger patients with fewer comorbidities, fewer medical issues. But I'm waiting on Dr. Byers and Dr. Dobbs to kind of sort through some of the information on that. But that's kind of the current thing. It's going to be easier to use depending on the amount that we get. It's just another great tool to have in our kit to get ahead of this pandemic and to get back to normalcy faster.
But you don't have any temperature problems as far as storage, and it's a single dose, isn't it?
Single dose, stored in the refrigerator in the same temperatures that we already store our influenza vaccines.
That makes it a heck of a lot easier.
Dramatically easier, with a roughly 70% effectiveness at preventing illness and somewhere close to 100% efficacy at preventing hospitalization or death.
Here's one question that's been popping up lately, and I'll ask you since I've got you on here, get free medical advice. I notice we get some people who've had this some way or the other, have the antibodies, and they think they had a case. Maybe they confirm that they did have COVID, and some of them are deciding not to get the shot or just wait. Is there any data out there on that?
There's some early data. I've talked in conversations with Dr. Dobbs. There's some data that he's made me aware of that indicate that the native immunity may not be quite as good as the vaccine-induced immunity. And so there's no reason not to do both. I'm a belt and suspenders guy for this kind of thing. There's, if you've had native immunity, God bless. You can wait. You don't have to, but you can wait up to 90 days to get the vaccine. But I encourage all of my patients who've had COVID to get the vaccine at an appropriate time. And that appropriate time begins as soon as 2 weeks after diagnosis if they are much better and are no longer symptomatic.
Got it. But there's no data on if you do have the antibodies, either three of those are better than one's better than the other.
getting if you've already got antibodies, going ahead and getting the vaccine is a solid idea. You should do it.
Yeah. Final thoughts on this subject from Mike Chaney, the Mississippi Insurance Commissioner and State Fire Marshal. So what do you want the Senate to do?
Well, I want the Senate to pass the bill that Senator Boyd has amended. Senator Michelle and Senator Boyd have worked hard on this. Mm-hmm. And the House Chair, Representative Hank Zuber, has said that we will have a bill of some sort. So we're going to work it all out.
When's the deadline on it, Mike?
The deadline to get things out of committee was yesterday. We do have two bills alive, so we got to next Wednesday to get something worked out on each floor, and then we'll go to conference after that.
You guys did a good job. We understand it a lot.